Hello, friends, and welcome back to the Frank American. If you're over 65, have a loved one who is, or have a hospital visit scheduled in the near future, make sure you stay with me through the end of this video. The information we're covering today could help you avoid losing thousands, and in some cases even tens of thousands of dollars, not because of a scam, not because of fraud, not because of paperwork error, but because of completely legal hospital billing practices that affect seniors every day across America. These situations happen to people who followed every instruction, signed every form they were handed, and believed they were fully covered, only to discover later that their Medicare benefits were affected in ways they never understood while they were sitting in a hospital room receiving care. Today, I am going to walk you through 5 specific hospital traps that every senior should know about, the exact phrases you can use to protect yourself, and an important Medicare-related update that took effect in 2026 which many people still haven't heard about. Before we begin, make sure you subscribe to the Frank American and turn on notifications. This channel is dedicated to sharing straightforward information that can help protect your health, your finances, and your retirement savings before problems arise. Subscribe now, and let's get started. The first trap is one of the most expensive mistakes seniors encounter, and many people don't even know it exists until after the damage has already been done. It's known as observation status. Even in 2026, healthcare advocates continue to describe it as one of the costliest Medicare billing issues affecting older Americans. Here's what happens. You arrive at a hospital. You're given a room and a bed. Nurses check on you. Doctors examine you. You may stay there for several days. You eat hospital food, wear hospital clothing, and receive what appears to be normal inpatient treatment. To you and your family, everything looks exactly like a hospital admission. There is no obvious difference. However, behind the scenes, the paperwork may tell a completely different story. Instead of being officially admitted as an inpatient, the hospital may classify you as an outpatient under observation status. Most patients are never clearly informed of this distinction, and from their perspective, there is often no visible sign that anything is different. That single administrative classification can have major financial consequences. If you later need rehabilitation services or care at a skilled nursing facility, Medicare Part A may not cover those costs. Medicare rules require a qualifying inpatient hospital stay of at least 3 consecutive days before skilled nursing facility rehabilitation becomes eligible for coverage. Time spent under observation status does not count toward that requirement. As a result, a senior who spends several nights in a hospital bed receiving treatment under observation status and then requires rehabilitation afterward may discover that Medicare does not consider the hospital stay to qualify. The rehabilitation bill can then become the patient's responsibility, potentially costing many thousands of dollars out of pocket. This isn't a rare scenario. Families across the country have reported being shocked when parents or grandparents spent multiple nights in the hospital and later learned that Medicare coverage would not apply to the rehabilitation care they needed because they had never technically been admitted as inpatients. Fortunately, recent changes have improved patient protections. Beginning in 2025, Medicare beneficiaries gained the right to challenge an observation status determination. Patients can request a review while still hospitalized and may also pursue an appeal after discharge. Advocacy organizations have documented successful appeals and have expanded educational resources to help beneficiaries understand this process. Another important change occurred in 2026. The Medicare Outpatient Observation Notice, commonly referred to as a Moon Notice, was revised. Hospitals are required to provide this written notice within 36 hours after placing a patient under observation status. The updated version explains in clearer language that the patient is considered an outpatient rather than an admitted inpatient and outlines how that distinction can affect Medicare coverage. If you or a loved one is hospitalized, ask directly whether you have received the Moon Notice. Simply asking, "Have I received my Medicare outpatient observation notice?" immediately signals that you understand your rights and prompts the hospital to address the question. There's another question every senior should ask. Am I admitted as an inpatient or am I under observation status? If the answer is observation status, follow up by saying, "I would like my status reviewed for possible inpatient admission based on medical necessity." That request should be documented, and many patients have successfully had their classification reevaluated after asking for a formal review. Another common trap begins when a patient schedules a procedure at a hospital that participates in their Medicare Advantage network. Everything appears to be covered. The hospital confirms that it is in-network. Then weeks later, an unexpected bill arrives from a physician the patient never selected and may never have even met. The hospital itself was covered, but a specialist involved in the treatment may not have been. It could be an anesthesiologist, a radiologist, a pathologist, or another physician whose services were billed separately. While the facility was in network, that particular provider may have belonged to a different network entirely. Many seniors are surprised to discover that coverage for the building does not automatically mean coverage for every professional working inside it. The result can be a bill worth hundreds or even thousands of dollars that nobody mentioned during the admission process. Federal law addresses this issue through the No Surprises Act. The purpose of the law is to protect patients from unexpected out-of-network charges when they did not intentionally choose an out-of-network provider. Yet many people never take advantage of one of the simplest protections available under the law because they don't know to ask. Before any procedure begins, tell the intake staff or billing office, I only consent to treatment by in-network providers under the No Surprises Act. Save that statement in your phone or write it down somewhere accessible. When that request is documented, it can provide important protection if an out-of-network provider later becomes involved in your care without your knowledge or consent. Another issue seniors encounter involves medication substitutions during hospital stays. Hospitals operate using formularies, which are approved lists of medications that the facility routinely stocks and dispenses. If the medication you normally take at home is not included on that list, the hospital may substitute another version, another brand, or a different generic equivalent. In some situations, patients are not fully informed about the change, and communication between departments can sometimes leave families unaware that a substitution has occurred. For older adults, especially those taking medications for blood pressure, heart conditions, or other chronic illnesses, even a seemingly minor medication change can have noticeable effects. Some patients experience fluctuations in blood pressure, dizziness, or other symptoms while their bodies adjust to a different formulation. In addition, hospital pharmacies often charge significantly higher prices than retail pharmacies, increasing overall treatment costs. One of the best ways to protect yourself is to prepare in advance. Keep a current written record of every medication you take, including the exact medication name, the precise dosage, and the schedule on which you take it. Having that information readily available can help you and your healthcare team identify substitutions quickly and make more informed decisions about your treatment. Make sure that list also includes the exact time you take each medication every day. Keep a printed copy in your wallet, your purse, or anywhere it can be accessed quickly during an emergency. If you are admitted to a hospital or if a family member is helping manage your care, provide that medication list to the admitting physician and state clearly, please do not change, replace, or adjust any of my long-term medications without a full clinical review and my written approval. By making that request up front, you create a clear expectation that any medication substitution must be discussed with you before it occurs. Another common problem involves the timing of hospital discharges. Hospitals often face pressure from insurers and administrative systems to free up beds and move patients through the system efficiently. Sometimes this results in seniors being encouraged to leave before they truly feel prepared to do so. A physician may tell you that you are stable enough to return home. Because the recommendation comes from a doctor, most people accept it without question. However, some patients discover only days later that they were not ready. They may suffer a fall, experience complications from a wound, struggle to manage medications, or end up back in the emergency room. In many cases, the consequences of leaving too early are far more serious and expensive than remaining in the hospital for additional observation or treatment. What many Medicare beneficiaries do not realize is that they have legal rights when it comes to discharge decisions. If you genuinely believe you are not medically ready to leave, or if your family has serious concerns about your condition, you can challenge the discharge decision. Medicare allows patients to request an expedited review through their designated quality improvement organization, commonly known as a QIO. Once that appeal is filed, the hospital generally cannot proceed with a discharge until the review process has been completed. This protection exists specifically to prevent patients from being sent home before they are medically prepared. If you find yourself in that situation, use this statement. I do not believe I am medically ready for discharge, and I would like to request an expedited appeal through the QIO. Those words immediately signal that you understand your rights. In many situations, simply making that request leads to a reassessment of the discharge plan and additional conversations about the patient's condition and readiness. The next trap may be one of the most important because it happens within minutes of entering the hospital. You're worried about your health. You may be in pain, exhausted, or focused on helping a loved one. Meanwhile, paperwork is being placed in front of you and staff members are waiting for signatures. Buried somewhere in those admission forms is often language stating that the patient accepts financial responsibility for services not covered by insurance. Sometimes the wording appears on its own page. Other times it is embedded deep within a longer document. Most people sign without carefully reviewing every detail because they are focused on receiving care. The problem is that those signatures may later be used to support direct billing for services that Medicare does not fully cover. Instead of benefiting from negotiated payment arrangements, patients can sometimes find themselves facing much larger charges than they expected. Fortunately, there is a simple step that may help document your intent. Before signing a financial responsibility form, write a clarification next to your signature. You are not refusing to sign. You are simply adding language that explains your understanding of the agreement. The statement many consumer advocates recommend is, signing only for authorized insurance benefits, not personal financial liability, for uncovered balance billing. You can write that statement directly beside your signature while the hospital representative is present. Doing so creates a written record of your intent and may help protect you if questions arise later regarding financial responsibility. Let's quickly review the key phrases every senior should keep handy before any hospital visit. Ask, am I admitted as an inpatient or am I under observation status? If necessary, follow up with, I am requesting a review of my status for formal inpatient admission based on medical necessity. Before procedures, state, I only consent to treatment by in-network providers under the No Surprises Act. Regarding medication, say, do not substitute my maintenance medications without a clinical review and my written consent. And before signing financial paperwork, add the statement, signing only for authorized insurance benefits, not personal financial liability for uncovered balance billing. These simple phrases can serve as a powerful hospital protection checklist. They take only a few seconds to say, but they may help prevent major financial and medical problems later. There's one more reminder worth emphasizing. The updated Moon Notice became required in 2026. If you or a loved one is placed under observation status and you have not received that notice within 36 hours, ask for it specifically by name. The right to challenge observation status exists today, but it only helps those who know the option is available. Every protection discussed in this video has one thing in common. You need to know about it before the situation happens. Hospitals are focused on delivering care, but they are not necessarily going to explain every billing rule, coverage limitation, or appeal right unless you ask. Thank you for spending time with us today on The Frank American. If you found this information helpful, subscribe to the channel and share this video with family members, friends, and anyone who may have a hospital visit in the future. A few minutes of preparation today could save someone from enormous stress, confusion, and unexpected expenses tomorrow. Thanks for watching, and I'll see you in the next video.